Hi, how you doing? Hope you're doing well. For today's videos, I'll talk about mental health technician and the process to get certified as a mental health technician in the United States of America. Hi again, my name is John. If you don't know, I used to work as an EMT in Los Angeles, California for about 2 years. I have worked 10, 12, 24, and 48-hour shift before I moved into working in a trauma hospital. And then I also work in a psychiatric hospital also. Now I'm working in the mental health field. So let's jump into today's topic. What is a mental health technician? Mental health technicians are frontline healthcare workers. They provide direct service to people who have mental illness, substance abuse, and developmental disorder. They have many responsibilities, especially if they're working in a psychiatric hospital. Some of the examples of mental health technician responsibility are taking vital signs, recording daily intakes, explore calories, like how much you eat, how much you drink, helping the therapist running group activity, group workshop, helping the nurse with observing the patient in the unit. But overall, your main job as a mental health technician is to observe all the patients inside the unit, make sure everyone is safe. That's your main job. Safety is the number one priority inside the psychiatric hospital. For mental health technician certification, it's vary by state. Some state will want you to have a certification. Some other state will just want you to have a BOS for healthcare provider and some experience, maybe a bachelor degree or college degree focused on mental health or psychology. So it depends on the state and where you live at. Personally for me, I used to work as a mental health worker. So especially working in Los Angeles, California, right? As a mental health worker, when I apply, right? Even though I don't have a certification as a mental health technician, I have a bachelor degree of science from UCLA. I have experience working as an EMT. I have taken care of psychiatric patients from psych ward and ER. I also work with patients when I was working in a trauma hospital. So overall, I do have experiences working with psychiatric patients. So when you get hired as a mental health worker, they do ask you about those experiences. So if you want to become a mental health technician through certification, you may pursue a voluntary national certification through American Association of Psychiatric Technicians, also known as AAPT. Here's the thing, the AAPT offers 4 levels of certification with the following requirements. Level 1, high school diploma or GED. Level 2, at least 480 hours of college or university courses, plus at least 1 year of work experience. For level 3, at least 960 hours of college or university courses, plus at least 2 years of work experiences. For level 4, you need a bachelor degree in mental health or developmental disability, plus at least 3 years of work experience. So these are 4 levels of certification that you could have through the AAPT. So another thing, regardless of certification level, everyone who wants to be certified, you need to pass level 1 certification examination. So that means that you need to pass the open book 201 question multiple choice test. Here's the thing, so after you pass this one, you can get your level 1 certification. But for higher levels, right? For example, like for level 2, 3, and 4, you also need to do another essay test. At the same time, you also might to show college transcript or a bachelor degree for high level. So it depends on the level requirement. So as I mentioned earlier, licensing and certification wise, it depends on state. So every state vary. Here in California, right? California have a strict license requirement for psychiatric technician. So you have to go through the Board of Vocational Nursing and Psychiatric Technician, which is called the PVNPT. In California, you must attend accredited psych tech school in order for you to get your license and your certification. So if you earn your psychiatric technician license in California, you could take that license to Colorado, Arkansas, or Kansas. These 3 states could recognize the license as a valid credential. Well, I hope you learned something new from this video. What is your thought on the mental health technician certification process? Let me know down in the comment below, and like and subscribe. On this channel, I talk about my life experiences and my journey in healthcare. Well, I hope you have a good day. Take care of yourself, believe in yourself, trust yourself, and love yourself. And I will see you again on the next video. Bye. Take care.